So in this video, we're just going to talk about the hormones of the adrenal gland. So it's a relatively short video. We've got these same topic and outcomes for a bunch of different videos, but we're focusing specifically on the adrenal gland. So the first one we've got is cortisol. And before I go any further, I just want to remind you how these diagrams are organized. So up top, up here, we've got kind of the stimulus. Up here, we've got the production site. The next is the target cells, and then at the bottom is the effect. Okay, so as you can see from the diagram, cortisol is released when ACTH, which is released from the anterior pituitary, is released. Stress and low blood glucose will also cause the adrenal gland to release cortisol. Okay, as I just mentioned, the production site is the adrenal gland, specifically the cortex, which is the outer layer of the adrenal gland. Some of these hormones are actually released by the adrenal medulla, which is the inner layer. It targets the liver, the fat cells and muscle cells. And ultimately what's happening with cortisol is it's trying to increase blood glucose and it's suppressing the immune system. Cortisol is referred to as the stress hormone, as we will talk about later on in the semester. Okay, but one of the things that happens if you have too high of cortisol for too long is it's a lot easier to get sick because you turn off your immune system, or at least turn it down. Next, we've got aldosterone. Okay, and aldosterone is something we're going to talk a lot about when we get to blood pressure and the urinary system. Okay, and so this is released when we have low blood pressure. Renin, which comes from the kidneys, ultimately causes a cascade of events that causes the release of aldosterone. It can also be released when potassium concentration is high or sodium concentration is low. Okay, this is produced in the adrenal cortex as well. Okay, it targets the kidneys, and ultimately what it's doing is it's increasing sodium reabsorption, so we're bringing sodium back into the bloodstream. We're getting rid of potassium, okay, and ultimately this will lead to an increase in blood pressure. This is kind of an indirect effect, but what happens is when we hold on to sodium, we hold on to water. And if you have more water in a balloon, you're going to have greater pressure in the balloon. The same is true of your blood vessels. So if we increase the amount of water that's in our bloodstream, we're going to have higher pressure. And then finally, we have epinephrine. Okay, we've talked about epinephrine. It's part of the fight or flight. Okay, so really stress, strong emotions. There's a signal from the nervous system. Okay, that ultimately causes the adrenal medulla to release epinephrine. Now, to be clear, I want to remind you that yes, some neurons do release epinephrine, but for this class, we're just kind of delineating neurons release norepinephrine. The adrenal gland releases epinephrine, although it's not that simple, okay? But just remember, adrenal medulla releases epinephrine. Okay, it targets a lot of things. So the heart, the blood vessels, muscle cells. This is that fight or flight response. So you're going to increase your heart rate, your blood pressure, metabolism. So if you're out in the forest and you see a bear, or you're swimming in the ocean and you see a shark, you're ready to go. Hopefully it doesn't end poorly for you though, if that happens. And so with this, can you just identify those three hormones released by the adrenal gland and identify their effects?